Okay, thank you very much, Ghulam. That was Dr. Ghulam Bahadur from London. And that was a very interesting talk, Ghulam. We will have the questions after the next talk. And the next talk is by Dr. Channa Jayasena. He is also an andrologist and from Imperial College and Hammersmith Hospital, London. And his talk will be on reducing sperm DNA fragmentation, oxidative stress, and recurrent pregnancy loss. So, Dr. Channa Jayasena.
Okay, so I'm grateful for the opportunity to talk to you today about this important topic, which gives us some insights into the causes of recurrent pregnancy loss. So here are my disclosures. And to put things into broader context, sperm counts in North America and Europe have dropped markedly since the 1970s. This was a much talked about systematic review and meta-analysis by Levine in 2017. And what this suggests is that potential causes such as obesity or pollutants, including endocrine disruptors, might be accounting for this. And what that means is that reproductive disorders may become more dominated by male factors as opposed to female factors in the future. So one area I'm going to focus on now is looking at recurrent pregnancy loss. So it's tragically quite common to have a miscarriage as a couple, but uncommon, so 1 to 2% of couples will tragically have recurrent pregnancy loss, so lose more than 3 pregnancies in the first half of pregnancy. And in half of cases that no cause is found, this is a devastating condition for affected couples. And in many centres, there's no routine screening of the male partner at all. And there's potentially a shift in the tide here, and let me explain one of the reasons why. So if we think broadly about risk factors for male infertility, we know that infection in the seminal plasma, varicocele, things that will warm the scrotum, such as prolonged cycling or long baths, which impairs spermatogenesis, or obesity, can reduce sperm quality. And we have a bit more of an idea now that how this may happen is sperm DNA fragmentation. So we know that if you create embryos using 2% paternal gametes, then there may be very good placentation but poor embryo growth. Conversely, if you use 2 maternal gametes, then you get then you will get poor placentation and good fetal growth. So what this collectively suggests is that sperm DNA may be playing a particular role in placentation, which means that recurrent pregnancy loss is a likely candidate for sperm DNA problems. And we know that from previous studies that if you look at male partners affected by recurrent pregnancy loss, then there is a higher risk than normal loss of sperm DNA fragmentation. But why does sperm DNA fragmentation actually occur? Well, one candidate, taking a step back up the pathway, one potential link between things such as heat stress, varicoceles, obesity, pollution, infections, could be oxidative stress. So these are chemicals which cause cellular damage, and they're byproducts of cellular metabolism. And we were interested in whether these could be partially accounting for how environmental factors could predispose to recurrent pregnancy loss. That was our hypothesis. So to do this, we needed a good way of measuring loss, and we have been fortunate to publish and describe our own luminol-based method, which essentially means that you add a control amount of the seminal plasma and you measure the color change, the oxidation of luminol using a luminometer, and you calibrate that to a standard curve. And you can then infer how much oxidative activity there must have been in the seminal plasma. And so we hypothesized that, specifically think about recurrent pregnancy loss, that might arise from increased sperm DNA fragmentation, which has been described, but that crucially might arise from semen ROS, which could be a missing link between all of this and these environmental factors. So we did a case control study at the Recurrent Miscarriage Clinic of St Mary's Hospital, recruiting 50 male partners affected by recurrent pregnancy loss and unaffected controls. We used semen analysis, we measured ROS, and used the Halo Sperm G2 method to measure sperm DNA fragmentation. So first of all, looking at endocrine parameters, which has not been looked at all in these men, and we found something very interesting. We found that men affected by recurrent pregnancy loss appeared to have lower levels of testicular steroidogenesis compared to controls. So testosterone and a byproduct of steroidogenesis, estradiol formation, appeared to be lower in the recurrent pregnancy loss group versus controls. Very interesting, because testosterone synthesis is needed for spermatogenesis. We next looked at the WHO semen parameters. So just to orientate you on these graphs, red equals recurrent pregnancy loss, grey equals control. And we're looking at all the semen parameters, as you can see. And what we saw was that volume, count, leukocytes were all very similar, but morphology was lower in the recurrent pregnancy loss group, as was motility and progressive motility. So these men do not have normal semen parameters. They seem to have poorer semen quality. But the starkest difference was when we looked at molecular parameters. So again, grey is control, red is recurrent pregnancy loss, and we're looking at ROS and sperm DNA fragmentation. And what you can see is that there is a marked difference. The recurrent pregnancy loss group is much more prone to elevated ROS and sperm DNA fragmentation. And if we quantify the diagnostic potential of these factors to predict recurrent pregnancy loss, one can see that so in a ROC curve analysis, 100% means the perfect test, which has 100% sensitivity and specificity always, and 50% means it's random. One can see that sperm DNA fragmentation, and to a lesser extent semen ROS, did have some diagnostic potential for delineating men with ROS with recurrent pregnancy loss from male controls. So what are the key findings here? So in our experience, men affected by recurrent pregnancy loss did have increased risk of low sperm motility and morphology, elevated ROS and sperm DNA fragmentation. And this supported routine, I think this supports routine investigation of all men whose partners are affected by recurrent pregnancy loss. And I think this is increasingly going to be adopted throughout Europe and worldwide. So we have a kind of a putative model here, whereby environmental factors which we think could account for male recurrent pregnancy loss appear to, that there's a potential for them to also cause semen ROS and sperm DNA fragmentation. So the obvious point is, what on earth can you do about this problem? Well, the obvious choice would be antioxidants. So now I'm going to talk more broadly about male infertility rather than recurrent pregnancy loss, because we don't have that data, but I think that data is needed. So we know that men who want to conceive, and particularly those with infertility, will empirically take antioxidants. And these could reduce, the idea is that they reduce semen ROS and improve sperm function. And the problem with this field, of course, is that there are quite heterogeneous effects observed, and there's a lack of mechanistic data. So what we wanted to try to do, and this was done with my colleague Jonathan Ramsey at the Hammersmith Hospital, was to try to do a small study to look at this. And so what we did was do a case control study whereby 44 men in our infertility clinic who had abnormal semen analysis. So these were men with male factor infertility, underwent semen ROS testing using our luminol method and semen analysis. Now, they all had daily administration of Proxeed plus, so termed LAL in these diagrams, so containing an L-acetyl-carnitine and L-carnitine and many other ingredients key to its effects. And this was over a 3-month period. And we dichotomized the group to those with a ROS greater than 10, so certainly a high level, or ROS levels less than 10. So a normal ROS group and a high ROS group. But just to emphasize, there was no control group. They were all treated with antioxidants, and they were all treatment naive. None of them had taken antioxidants in the past. After 3 months of treatment, they all underwent repeated semen ROS and semen analysis testing. So looking at baseline characteristics, there were no significant differences in any parameters. So the high ROS group and the low ROS group, they certainly didn't have any significant differences, although you could see there was perhaps a trend for the high ROS group to have worse semen parameters. So if looking at the first group, those with the normal ROS, what happened before and after Proxeed plus treatment? Well, it's interesting. So this almost goes against the grain of some other studies, but we suggested that volume, motility, concentration, and progressive motility didn't change. So if your ROS started out being normal, giving an antioxidant didn't affect things. And if we looked at the amount of ROS before and after treatment with Proxeed plus, there was no significant difference because it was normal at the start. And if you got normal ROS at the start, you're not exactly going to reduce that. But if you then take the group who started off with elevated ROS, so remember, these are men in a clinic with male factor infertility who had elevated ROS. Look what you see. You see something very different. You see elevations, improvements in concentration, motility, and progressive motility, which are sizable. And look, these are the men who start with elevated ROS. And what this shows is that if you've got an elevated ROS at baseline, then taking an antioxidant such as Proxeed plus is going to have a big difference in reducing your oxidative stress and could have important potential improvements in function. And so if we just combine all the data together, remember, we took 44 men who were just in our clinic who had male factor infertility, who were treatment naive. If you start off with a high ROS, you're going to really reduce ROS in your seminal plasma, which is associated with improvements in your fertility. If your ROS is normal, then we're not going to make any difference. And that's quite nice because I think it adds an important mechanistic data to how these antioxidants may rationally work. And similarly, if you look at change in total motility, progressive motility, and sperm counts, it's the people who start off with the high ROS with potentially these risk factors such as obesity, etc., who stand the most to benefit. So to close up, to interpret, so men with infertility and high seminal ROS, well, these men have potential for improvement with therapies such as Proxeed plus to improve sperm concentration, counts, and progressive motility. But in fertile men with normal seminal ROS, well, there's probably no benefit in taking it. And therefore, carnitine therapy such as Proxeed plus has potential to increase sperm function in some infertile men. And we think our results go a long way to explaining why there have been differences in reporting of the literature. So I want to close by thanking all my senior colleagues who helped me greatly perform this work. And in addition, I don't have his photo here, my colleague and friend, Professor Suxmin Haas, who collaborates with me constantly on these studies. Thank you.